Hi everyone, this is Dr. Farida Rajan Ibrahim Omasundi. So today we are going to look at pelvic inflammatory disease. We are going to look at the causes, the symptoms, as well as the complications. And if you haven't yet liked this channel or subscribed, please do like, share, and subscribe. So what is pelvic inflammatory disease? So this is a spectrum of infection and inflammation of the upper genital tract organs, typically involving the uterus or the endometrium, the fallopian tubes, the ovaries, the pelvic peritoneum, as well as surrounding structures. So what happens is that there is an ascent of microorganisms from the cervico-vaginal canal to the contiguous pelvic structures, thereby leading to conditions such as endometritis, salpingitis, pelvic peritonitis, as well as tubal ovarian abscess. So what then are the causes? Mostly, PID is commonly caused by sexually transmitted infections, more especially chlamydia trachomatis and Neisseria gonorrhea. However, it can be caused also due to normal vaginal flora like Gardnerella vaginalis. So those also can contribute to the cause of PID. So what then are the risk factors? So basically, being young, starting to have sex at a young age, being sexually active at a young age, especially in the age range of 15, that can be a predisposing factor. Having a UID in situ, like recent intrauterine device insertion, having unprotected sexual intercourse, having multiple sexual partners, douching also disrupt normal vaginal flora, a history of STI, and also a history of pelvic inflammatory disease can also be risk factors for developing pelvic inflammatory disease. So those are just some of the risk factors. Coming to the symptoms, you can have nausea and vomiting, especially in severe cases. There can be irregular menstrual bleeding. There can be painful sexual intercourse, which we call dyspareunia. There can be lower abdominal pain or pelvic pain. Sometimes the patient can come in with fever and chills. Sometimes even painful urination, which we call dysuria. Sometimes even abnormal vaginal discharge. And in this case, in most cases, it is foul smelling. So those are just some of the symptoms that the patients may present with. And then coming to the complications, so we can have there can be scar tissue formation, which can lead to chronic pelvic pain. And sometimes if the fallopian tubes are blocked, the patient can have infertility. Sometimes you find that the eggs fertilize or implants outside the uterus, so there can be formation of an ectopic pregnancy. We can also experience tubal ovarian abscess, as well as peritonitis and sepsis if the infection spreads to the abdomen. So those are just some of the complications that might present in pelvic inflammatory disease patients. That was just a brief overview. So do like, share, and subscribe, and look out for the upcoming video. Thank you so much for watching.